Hi, thank you for coming to your diabetic foot exam. I'm going to start off by first saying that we did get your blood work at the beginning, so that will be able to check your hemoglobin A1C, which we do want to be less than 6.5 is our goal, and then your fasting blood glucose as well as other labs. With all that, we'll be able to see through your blood work if things are being controlled, if we need to kind of tweak some of your medicines, and I know that you typically help us out really well. I'm going to be a good patient because you check your blood glucose every single day before all of your meals. And one of other thing is you're here for your foot exam. That is to hopefully prevent any complication of diabetes in the form of neuropathy. Also, other complications can be nephropathy and retinopathy. So that's why we recommend that you see an ophthalmologist at least annually, and then obviously see us annually. And if there are other issues, we'll talk at the end about follow-up, but other issues you might need to come in a little bit sooner. But other history questions that we've already gotten from you is when you were first diagnosed with diabetes, if you've had any ulcerations or amputations, which you haven't had any amputations, and then your history is, have you had any ulcerations before on your feet?
No.
Okay, perfect. Because that actually is the greatest risk factor for the formation of an ulcer, is having a previous one. Because any area that is calloused or shows that there's been more pressure is going to be a greater risk for the formation of an ulcer. So we'll just start by looking at your feet and just inspecting it musculoskeletally. There doesn't seem to be any obvious deformities or prominent toes. There doesn't seem to be any kind of prominent metatarsal heads. They're all pretty even. If a plantar surface was more flexed, then you can see how you'd have more pressure on that end and could cause an ulcer formation. But that is good. And also, your heels can go further than 90 degrees, which is great because that means you don't have a tight or equinus Achilles tendon. If that was the case and you couldn't move past 90 degrees, then you would definitely be putting more pressure up here and more risk of an ulceration. Other things that we typically look at, I'm just let you know what the different things to keep an eye on, and what we keep an eye on is that you don't have a ton of an arch, but you do have an arch here because we don't want the foot to somewhat collapse, because if it collapsed and you didn't realize it, then you probably do have a lot of neuropathy going on, because that's actually breaking of the foot and can pose lots of difficulties. But no, that's not where you're at today, and you're doing really well. I have already felt that both of your feet are the same temperature, and they're warm to the touch, warm and dry. And if they were red or hot, and just especially on one foot, then that could be an infection. It's definitely something we want to see and check out. But on the other hand, if they were dry and cyanotic and really cool to the touch, then that could be a risk factor for, or that could be showing poor circulation. Also things like varicose veins, especially on the inside of your leg, and any swelling around the ankles. Those both can be signs of poor circulation. So just different things you can keep an eye on as you do your daily foot checks, right?
That's correct.
Okay, good. Also, as far as circulation, I can check your capillary refill. Should be less than 3 seconds. If it's greater than 3 seconds, then that could show poor circulation. Also, you don't have any curved toes or hammer toes, claw toes. If you did, then that could mean that you're having a callus formation at the top here. That's what I would probably see, and that could lead to problems with an ulcer. Now, since I'm doing some more circulation, I'm going to feel both your pulses. You have dorsalis pedis on the top here, and then posterior tibial on the back. Both of those are very strong and good, and they are similar to when I checked your radials. And so you want all of those to be equal, because if those were diminished, then that could be of concern of getting not as strong blood flow. And you also have hair growth here on your toes that's showing that you are having good circulation all the way down to your toes. Okay, so now we're going to do more of your neuro assessment here. And we're going to start with this monofilament. This is actually the gold standard for testing of sensation and to make sure that your nerves are functioning. This is it's a positive test, or it's a showing that you have your protective sensation when you feel the touch of this, or you feel when it bends. So what I'm going to do is I'm going to start here and at your the plantar surface of your big toe, and I want you to close your eyes and let me know when you feel something. Okay?
Okay.
Okay.
Now.
Good.
Now.
Good.
Now.
Going to the 3 areas.
Now.
Of your
now.
At the metatarsal there. Good job.
Now.
Good. And the dorsum of your foot.
Now.
Good. This other foot.
Now. 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 Now.
Good job. So this, like I said, is the most sensitive test. And if you had 1 or 2 areas that you did not feel, that could be a great risk factor for forming an ulcer in that area. Now we'll go to the vibratory testing with this tuning fork, and this is something that would kind of diminish first before the light touch test that we just did. And this is kind of, the next few tools are used to monitor the progression of the diabetes, because decreased sensation in these first can kind of show the starting of neuropathy. And so we want to keep a better eye. Okay, I guess I should say what I'm going to do. I'm going to hit this and make it vibrate and put it on the top of your toe. And I want you to tell me when you don't feel it anymore, okay?
Okay. Now.
Good. You didn't feel it anymore, any longer than I felt it on my hand. So when it went away for me, it went away for your toes. So if you had said it stopped before my hand stopped, then that would show decreased sensation. Okay, one more.
Now.
Perfect. Good job. So you're doing great there. No worries. Last thing, I want you to close your eyes and tell me when you feel something soft, or if you feel something, no, I didn't mean to say soft. You feel something sharp or something dull, okay?
Okay. Dull.
Good.
Sharp.
Good.
Sharp. Dull.
Okay, perfect. This is more proof that you're doing a good job and your nerves are still intact and working well. I'm going to check your reflexes, and this is checking your Achilles tendon. Good job. Oh, sorry. All right. Okay, good. And like I said, in surveying your feet, there's no obvious deformities. Your vascular system is working well. Your neural system is working well. Something to just be aware of. We want to keep your checking your feet every day. And something that is a slight concern is they're very dry, and so any kind of little cracking that we have here could lead to an infection or a problem. Especially there is slight callus formation on the outside of your heels, and that could be where you're putting more pressure when you walk. So if you want to get go to a place and let them size shoes for you, or measure your feet to make sure that your shoes aren't too narrow or too wide or too big for you or too small. We want to just make sure that you have some fitting you well. And also a good thing to do always is to put your feet in first before you put your hand in first before you put your feet, so you can make sure there's no rocks or anything on your feet or in your shoe that you would hurt your feet on. But overall, like I said, your feet are good. We'd already looked, no signs of fungal infections between your toe or thickening of your nails. That's also indicative. I think you're doing great. So if you had any signs of neuropathy, you come back in 6 months. And then if you had any foot deformities or poor circulation, you come back in 3 months. And if you have previous ulcerations, which you don't, come back in 2 months or sooner. And the only thing left is to congratulate you that you do not smoke, because if you did, we would definitely be talking more about that. And it's just a hazard of increasing your decrease of circulation and cardiovascular risks. And we don't need any more risks because you're doing a great job.
Perfect. Perfect.
Okay. I'll see you next year.
Perfect. Thank you.